I'm Chris McReynolds, and this is my friend Remy. I'm a small animal veterinary internist and owner of Southern Colorado Veterinary Internal Medicine. For some time, I've wanted to make a video on amputation in the dog and cat. Unfortunately, if you're watching this video, there's a good chance that your dog or cat has been diagnosed with bone cancer or has received significant trauma to a leg, and your veterinarian is recommending amputation. I know this is a very difficult time for you, but hopefully I, along with my friends, can show you that there is life after amputation.
In most cases, the affected leg that is being considered for amputation is causing significant pain. The amputation surgery takes approximately 1.5 hours in the operating suite. Following surgery, all of our patients recover in our 24-hour intensive care facility. Surprising, the majority of our amputees go home the next day. In cases of bone cancer, we often recommend chemotherapy. Within 2 weeks of amputation, most patients are no longer in need of pain medications, and many are outrunning their humans. I often feel actions speak louder than words, so with the help of some of our friends, I'd like to show you how life can be pain-free on 3.
Well, we have 2 Danes, and I think Hattie's 7 and Hobbs is 8, 8.5. And, when Hobbsy got his left front shoulder removed with cancer, and Hattie came in with a bump on her back rear leg, we took her in, and there was another mind-blowing thing that all of a sudden we had 2 with cancer, within a month actually, and diagnosed, and so we just brought her right in as soon as we could get her scheduled, and we got her taken care of.
At first, I didn't want to do it. It just seemed like something that was too much to put him through. But after I talked with some other people who had amputation done on their dogs, we decided that we wanted to go for it.
The best thing for him, obviously, was to have the amputation medically, and that physically he would be okay with the amputation. I had to get my head around whether he would be the same dog.
I was just glad it wasn't something that we couldn't do anything about and had to put him down.
You run through those emotions, and then you just stop yourself and go, okay, now what?
There was no doubt we were going to do it. If it was for 6 months, a year, 2 years, whatever.
The morning after surgery, I took Dodger outside to see if he would walk on the grass, and I was amazed to have him walk across the grass to me. It was the most amazing feeling to see him emotionally deal with it so quickly. He was a little tentative at first, and he kind of jumped across. He figured out what to do with his front leg, and he hopped over, and it was a very emotional moment for me and for him too, I think, because that was the first time he figured it out, and it was 12 hours after surgery, 14 hours after surgery. So it was pretty amazing.
It was actually a lot easier than I expected. I had hired someone to stay with Pepper during the day while I worked, but after a couple of days it was apparent that he really didn't need anybody and was able to do everything on his own.
After about 10 days, I mean, he just started to blossom, and it was his old self, wanting cookies and getting up and walking outside and going to the bathroom. And I mean, we had to help him along, here and there. But he just started getting his personality back, and it's been so worth it. I just can't believe how good it's been.
2 weeks after the surgery, shortly after we had the sutures removed, he was running at full speed and bounding through the fields near our house and beating the other dogs at retrieving the ball. I was amazed.
2 weeks after the surgery, Pepper was doing great. He was walking around on his own. He could run. Not very fast, but he was running. He still doesn't run fast. I'm not sure if Pepper ever ran fast.
We've been through it twice, and it's tearful, and but it's at the end of she's been there, I think, almost 2 weeks now, and she's awesome. I mean, she's up and running, both of them, and they got their funny little hops, and they're just back to Hattie and Hobbs, and I mean, we're back to being more normal, and it was all well worth it.
It has been almost 5 years since his surgery. He is doing quite well. We go on hikes. We were snowshoeing this last weekend with him, and he did well.
It's been 4.5 years since his surgery, and he's amazing. He does everything a normal dog does.
It's been about 5 weeks, and he's awesome. He wants to get out, go outside all the time, and walk around we live in the country, and he's up and down the banks, and he's out smelling the smells and walking all around. I worry how much he wants to walk, how far he wants to go, and he doesn't seem to get tired like he did, and he just, like I say, he's back to his old self. He's just three-legged.
The big thing has absolutely been maintaining the normal routine that we always have had despite the loss of a leg. It was really a minor inconvenience for him, and so I need to treat it as such.
And you'll see that their whole life comes back. Their personalities, in fact, I think they even become more deeper attached than you thought you were, because they just start showing that love again, and the tail's wagging, and they're just having a great time, and they're back to normal.
I understand what a big deal it seems like it is, but for the dog, it's just a normal thing. They get used to it so quickly, and they adjust so easily. And so if it makes a difference between having your dog and not having your dog, absolutely it should be a consideration.
There is a wonderful website called tripods.com. On that site, the creator is often quoted in saying that it's better to hop on 3 than to limp on 4. After being involved in over 1,000 cases requiring amputation, I firmly believe that our amputee patients are happier and live a better quality of life on 3 legs than 4.